Hi everyone, I am Kendall. I have been a registered nurse for 6 years and I work in the neonatal intensive care unit. As I continue to gain knowledge and experience as a nurse, I have recently taken part in a college debate over North Carolina House Bill 870, the End of Life Option Act. The proposed End of Life Option Act allows providers and patients to communicate and explore assisted death and dying for those who are terminally ill. The North Carolina End of Life Option Act was filed April 16, 2019. 6 days later, on April 22nd, 2019, the bill passed its first reading and now currently remains to be reviewed within the Committee on Rules, Calendar, and Operations of the House. While the legislation is currently on a pause frame, I have had the opportunity to examine and review literature in both supporting and opposing the legislation. Today, patient autonomy and involvement is a main focus in providing patient-centered care, which is a strong supporting point in passing North Carolina's End of Life Option Act. Patients should be allowed to have the autonomy to discuss and decide upon care. On the other side of the stance is the opposing side of the End of Life Option Act, and I found it most interesting that there is a correlation between patients who are terminally ill and having a psychological disorder such as depression. While I find my decision to be split in supporting and opposing the legislation, I had to break it down into pros and cons and found that I was able to justify an opposing view to the legislation. First point in opposing the End of Life Option Act includes the Hippocratic Oath, which goes against preventing harm and creates moral and ethical dilemmas. While the bill does not require a provider and/or medical care team to provide medically assisted dying, a patient could seek to gain further information which must be provided and educated upon, even if one doesn't agree with it. Secondly, there's a correlation between depression rates and the desire to end their own life, even in the terminally ill patients. Lastly, the third reason in which the End of Life Option Act currently is opposed is that palliative care is underutilized and the bill should require more utilization of palliative care. In opposing North Carolina's End of Life Option Act, I believe the bill should be stopped and reassessed in providing more defining boundaries and pre-qualifications of having to have been enrolled and extensively receive palliative and hospice care. Additionally, families should be notified in a patient's desire to end their own life, which would allow additional assessments and interventions to be provided, especially if a family is able to recognize the patient as being depressed. Also, lastly, I believe that there is a gray area in defining terminally ill, as an individual with clinical depression can battle the diagnosis for years and would not be allowed to have the option of ending their own life, and it wouldn't be acceptable within society. As nurses, it is important to utilize the acronym ADPI: assess, diagnose, plan, implement, and evaluate to provide quality care. If there is a high correlation between depression and the desire to end their own life, even in terminally ill patients, have we as nurses done our due diligence of utilizing the acronym ADPI in providing intervention and in providing patient-centered quality care? I believe that this bill should require more involved interdisciplinary communication, diagnosing, treatment, and interventions before being allowed to utilize the End of Life Option Act.